parents are reaching out to you, root cause analysis is what you are talking about, right?
Yes.
Like finding out where the infection happened or any kind of inflammation that is there in the system. How much time it will require to find out the exact cause? Because parents needs to have patience to understand what's wrong with my child.
Yes. So it's a long journey.
Hmm.
Now, typically testing we do, it takes 7-10 days to get the reports and etc.
Okay.
And after that we analyze these reports.
Mhm.
Not that these reports will give everything, but broadly gives us a direction.
Okay.
There are chronic infections in the body which is affecting the gut, which is affecting the brain. There are toxicities, especially heavy metals, and probably microplastics is another one we should look into.
Yeah.
We should use your help in that case.
Sure, we'll do that.
Heavy metals which are neurotoxic, immunotoxic,
Okay.
mercury, aluminium, lead, arsenic, barium, etc., etc. Then interestingly, these children have a very low nutrition in them.
Okay.
Their fatty acids are low, their phospholipids are low, their amino acids are low, their B vitamins are low, their zinc, magnesium is low. Baseline nutrition is very low. Now, it's a developing child, growing body. It has to repair, regenerate, and grow. If we don't even have enough proper nutrition, how will the body develop?
Correct.
Repair, regenerate, forget about it. Okay, so that is why this whole sequence of growth is halted.
Correct.
So we look at all these things. The liver markers are actually a big problem. Many of them, the OTPTs are very high because the gut is bad and gut microbiome producing a lot of toxic waste affecting the liver health.
Okay.
The detoxification is compromised. And many of time these children are autoimmune in nature, in the sense that we are not able to test their autoantibodies for the brain.
Okay.
Not possible in India, but in outside India, a lot of people are working on this part. But at least in India, we test their ANA and anti-CCP.
Okay.
Now they don't have a joint pain and all that, but their ANA and anti-CCP are in a range which is an autoimmune condition itself in them. But that is not affecting the joints at that point of time, but at least we get a reference that their body, their immune system is haywire in a state of autoimmunity. And then if we test more antibodies, probably we'll get a more picture clarity.
Okay.
So this typically process can take maybe 10 days, 2 weeks. And then we process the reports, we analyze the reports and tell the parents this is wrong. And these are the things they need to do over a period of time. We cannot fix all the things at once. So slowly, gradually, one thing at a time, we keep doing.
Okay. And is it very expensive to do the root cause analysis?
Not exactly. See, earlier, a lot of the people who work in the similar fashion, they would run all the tests in US. Then it becomes expensive.
Correct.
At least, 60,000-80,000 rupees per thing. But now we do most of the testing in India. There are labs, good labs in India also.
Correct.
So give and take 10,000-12,000 to 15,000 rupees for 3 months.
Okay.
So we do test every 3 months. So we can track
Okay.
how the child is changing, how the improvements are coming, plus how the markers are improving.
Correct.
So it has to be sort of parallel, linear path.
Correct.
In the sense that
Still quality evidence-based.
Yes, absolutely.
Yeah.
So we keep doing every 3 months. So 10 to 12K or 15K every 3 months.
That's fair.
Yes.
Initially all these high-end investigations, we used to send it abroad and we used to say that it's not possible in India.
Yes.
But now good labs are there.
Yes.
So once the child will be knowing that, okay, this is the root cause and these are the things that we have to start fixing, how the family should actually react to this? Like parents, is there acceptance issues or how exactly, what's your experience with that?
Right. See, they are willing, more than willing. They know the problem already because they have already been going from one place to another place.
Correct.
They are already knowing that they have to fix it and something is not right with my child. Now, when they come to us, our path is not easy. In the sense, we don't say go to a therapy center and parent is easy going in that period. It's not life of parent is not easy.
Correct.
Okay. But we say, okay, these are 20 problems, 30 problems are there in your child, but we cannot solve all of them. But we start with the baseline. You change the diet, you change the lifestyle, start with that, and a little bit of a supplementation. What are the missing things in the body? Then slowly, gradually, we start cleaning out the system from the infections, from the toxins. That's the first level of things we do. Now, because change is always tough. Parents want to do it, but change is tough. And sustainable change is even more tougher. Some parents do it for 1, 2, 3 months, then they sort of give up. And some persistent guys and they who has that in them, they're doing it for at least 1.5 years to 2 years, and they gradually every 3 months, every 6 months, they keep seeing that there's, new things are happening with the child. What they have lost in the regression is they're regaining most of the problems, getting better.
Okay. And what's the results you are able to see? Like if we talk in terms of percentage of children, those who were able to recover.
Yes.
So what's your experience in that?
So I would say, if a parent is able to follow with us for at least 9 months to 1.5 years, persistently, consistently, without a break, 80% of the children, and when they come early to us in the stage of, let's say, 3 years to 6 years or 3 years to 9 years, earlier it is, better it is. So we can safely say that we can pull them out of the problem.
Okay. And it is like once assume that like somebody who's very, very dedicated, parents are very dedicated, they are religiously taking care of a child for 2 years, change their lifestyle, change siblings' lifestyle, change the whole family lifestyle to be aligned with something that will help the child who probably have some kind of a thing and who's going through the complete treatment with you. Now in that case, after 2 years, how frequently they need to do the follow-up?
See, again, once the problem is settled, okay, language has improved, muted child has become communicable child, their behaviors have settled in because the root causes are settled in. So once in 6 months, if they, now once we have repaired the car, we just have to keep maintaining it.
Correct.
Now, initially, probably every 6 months, if we run one round of testing and see what are the parameters, if any small interventions are required, we can do that. If not required, we can let them be. Just, it is important that they maintain a healthy lifestyle and food. At least that should continue as much as they can. And large part of the treatment can be off.
Okay.